Hey, welcome. John Freitag with Freitag Family Agency, and today I'd like to go over just some Medicare benefits. I've been doing this presentation with seniors, and they seem to really appreciate it because there's lots of different benefits that are available on Advantage plans that people know they have, but they might not really understand how they can use them. And what good is having something if you can't use it, right? So this is going to be real high level overview of some of these plans or some of the benefits for these plans. Can't really go into plan specifics because every plan's different and this stuff does change. But this is just a high level overview. So if you have specific questions, feel free to reach out to me and I'd be happy to help you with whatever I can. So we're going to talk about a couple different things. First off, we're going to talk OTC. And what is OTC? So that's over the counter. When you think OTC, you're probably thinking just like your Tylenol, your aspirins, those types of things. But OTC covers a lot more than just those medications. So it covers over-counter medications. It also covers some safety devices. It covers dental care. It covers first aid, incontinence supplies. If you need help quitting smoking, it covers some of those items as well. Usually, when you're in a plan, an Advantage plan that covers OTC, they'll probably send you a thick package with everything in it. You'll get a catalog from the carrier. You can do phone orders. So you call in, you tell them all the things that you want to order. They'll punch it in and send it to your house. You can order online. You use your catalog, or they have an online website that you can plug everything in and order stuff. You can even go into some stores. So some stores are set up, either private pharmacies or the bigger chain pharmacies. Some might actually have the item sitting there in the store on an end cap that says OTC, or it might have like a little star or something there at the price tag, and it'll say this is OTC eligible. Some are a little bit tougher, and you actually have to bring everything up to the counter. They'll scan it and they'll see if it's OTC eligible or not. Um, you just ask the pharmacy staff; they'll be able to help you there. I've talked to different pharmacies, and some say that even if it's the same chain, that other stores are set up different, so they know which ones are marked, so it's easier. So they can point you in the right direction if you want to use a different store. Some carriers send separate cards, so you'll have your regular card that you use at the doctor, and you'll have your OTC card. A lot seem to be moving towards a single card system, which is a lot more convenient for people. You don't have to have multiple cards. You have enough, different cards in your wallet. So you have the one card, use it at the pharmacy, and you can ring up your stuff and save some money. Utilize your benefits that you have. So that's OTC. The second one I want to talk about is transport. So original Medicare covers emergency transportation. Something happens, you need to go, ambulance to the hospital. So non-emergency stuff, a lot of Advantage plans now offer trips to doctor's appointments. Some are even expanded to cover fitness appointments, so bring you to the gym. And every plan is different. So transportation methods can vary between rideshare like Uber or Lyft. Some use a taxi, some can help you with a bus. So you can call the number that's either on your welcome kit or on your card, and you can set up a trip. A lot of them are going to require advance notice, so you can't call them like the day of. You might have to call them a few days before and set everything up. But here's a nice fact. If you're here in the Philly area, like I'm at, we have SEPTA. So SEPTA has a thing for seniors over 65. You can ride for free all day on the SEPTA buses, the trolleys, the subways, regional rail, all of them. All you have to do is get a senior fare card. And I'm in the Philly suburbs. I'm out in Bucks County, so it might be a pain in the butt for me or other seniors to get down to the SEPTA headquarters down in Center City. So you can actually reach out to your local legislators, and a lot of them are set up to get you the card there. So you can look online and look up who your local representative is, and a lot of them, you can call them up and see if you can go in there and get the card there. So that's a real helpful hint if you're in the area. And if you're in a city that doesn't have SEPTA, chances are that they have something similar set up. So that's something to look into too for transport. Another thing, dental, vision, hearing, and these are probably one of the most popular parts of why people go on Advantage plans. They're all going to vary, but what you can do is you go on your provider's website, or you can call them up, and you want to look at their network, and you'll look at the network, and you'll see which dentist or which eye doctor or which audiologist is going to be in your network. Many plans are really getting generous. In my area, they're starting to realize that a lot of your health starts with your mouth, and they're really they're putting their money where their mouth is, right? So um, they're helping out that you can go get first dollar coverage with a lot of these plans. And if you've been putting off dental work, you've been, just hard paying all these bills because dentists are expensive. Check it out because these plans are changing every year. A lot of them are getting very competitive, so it's worth checking out. But hop online. You can look at your provider's network. That's how you do that. Fitness. So I actually I had the honor of sitting in a fitness class the other day for seniors. It was pretty fun. So you've heard of a lot of the popular ones. I won't mention their names, but has sneakers in the name, right? So they're at all these fitness locations. So you can look, just go to your local gym. They'll usually have a sign on the door. Talk to the person at the front desk there. Show them your card. Tell them what you want. Most of it's free. So you'll be able to have certain classes that are set up for seniors on these programs. They have tons of different things. They have Zumba, Tai Chi, cycling. I mean, you name it. But just go to your local gym, show them the card that you have, and chances are they're affiliated with either that one or another one. But there are no cost access to fitness locations. I've heard some people say that the gym might have told them you only get one or two visits a week. That shouldn't be the case. You should be able to go as often as you want with this card. Everything's going to be different, obviously. Plans vary, but for the most part, you should have unlimited access to these gym programs. So I hope that gives you some info. Again, it's really a broad overview, but these are just some really good extras that these plans have, and people don't utilize them, and they're there. Use them. Take advantage of them. Get the stuff that you need. Save a little bit of cash. That's why you have it, right? Any questions? Feel free to reach out. John Freitag, Freitag Family Agency. Have a great one.